How does hand hygiene prevent cross-infection? Imagine a simple act that can make a big difference in protecting someone with cystic fibrosis from serious lung infections. That act is hand hygiene. People with cystic fibrosis are especially vulnerable to bacteria and viruses that can cause lung problems. These germs can spread easily through contact with contaminated surfaces, respiratory secretions, or even other people. When hands are not cleaned properly, they can carry these harmful pathogens from one place to another, increasing the risk of infection. Washing hands with soap and water, or using alcohol-based hand rubs is highly effective at removing or killing these germs. Soap works by breaking down the outer layers of bacteria and viruses, making them easy to wash away. Alcohol-based sanitizers are quick and effective at reducing bacteria and viruses on the skin, especially when soap and water are not available. However, if hands are visibly dirty or greasy, washing with soap and water is the better choice. Preventing direct contact is another key benefit of good hand hygiene. Touching the face, mouth, or respiratory equipment with clean hands can transfer germs directly into the body. By keeping hands clean, the chance of passing these pathogens to mucous membranes or medical devices that lead to the lungs is greatly reduced. Cleaning hands also helps prevent environmental contamination. Surfaces and shared equipment in homes, clinics, or hospitals can harbor germs. When people with cystic fibrosis, their families, or healthcare workers practice good hand hygiene, they limit the spread of bacteria and viruses to these surfaces, reducing the risk of cross-infection. Using alcohol-based hand sanitizers is recommended because they are quick and effective at reducing germs. But if hands are dirty or sticky, washing with soap and water is more thorough. It's also important for healthcare workers and caregivers to avoid artificial nails, as these can harbor germs even after washing. Timing is crucial too. Hand hygiene should be done before and after touching a person with cystic fibrosis, after coughing or blowing the nose, and after handling respiratory equipment or contaminated surfaces. This routine helps stop germs from spreading from one person or place to another. Practicing good hand hygiene is part of a larger infection control plan. It includes physical distancing from other cystic fibrosis patients, wearing masks, and cleaning shared spaces and equipment regularly. When everyone commits to these simple steps, the risk of harmful bacteria and viruses causing lung infections drops significantly. This helps keep lungs healthier and prevents serious complications. Following these guidelines aligns with recommendations from health authorities and is a proven way to protect those with cystic fibrosis from cross-infection. Always remember, for personalized advice, it's best to consult healthcare professionals who understand individual needs and circumstances.